Have you ever heard of a condition where an injury to one eye causes the other eye to go blind? This rare medical condition is known as sympathetic ophthalmia, and that's our topic today. This occurs after a penetrating eye injury or after a surgery. We will explore its causes, symptoms, and treatment options. Understanding this condition is vital for protecting our vision. Sympathetic ophthalmia is an autoimmune disease. It happens when an injury to one eye triggers an immune response against both eyes. The injured eye is called the inciting eye. The unaffected eye is called the sympathizing eye. This is why the disease is called by this name, because this eye sympathizes with the injured one. This condition affects the uvea. The uvea is the middle layer of the eye. It contains the iris, the ciliary body, and the choroid, which nourishes the retina. Our immune system protects us from infections and diseases. It acts as a defense mechanism, constantly on the lookout for harmful invaders. It does this by recognizing and attacking foreign invaders like bacteria and viruses. These invaders can cause infections and other health issues if not dealt with promptly. Sometimes, the immune system mistakenly attacks the body's own cells, thinking they are threats. This is called an autoimmune reaction. Autoimmune diseases can affect various parts of the body and lead to chronic health problems. In sympathetic ophthalmia, the immune system sees proteins from the injured eye as foreign invaders because these areas have been isolated from immune recognition by the blood-retina barrier. It then attacks the uvea in both eyes, even though the sympathizing eye is not injured. This misguided attack can lead to vision problems and requires medical attention. But how does this happen? How can the immune system attack the healthy eye after the other one is injured? And what is this barrier that protects the eye in the first place? Have you ever heard that the eye has its own immune system separate from the rest of the body? Yes, it sounds strange, but it's true. The eye is not like any other organ, as the immune system does not fully recognize it. There is the blood-ocular barrier that acts as a fortress, preventing immune cells from entering the eye and interacting with its internal components. This protection prevents excessive inflammation and maintains the sensitive environment of the eye. This barrier is primarily composed of the retina and the surrounding blood vessels, known as the blood-retinal barrier, along with other parts such as the blood-aqueous barrier and the blood-choroidal barrier. But what if this barrier is broken? What if the hidden proteins inside the eye leak into the bloodstream? This is where the problem occurs. The immune system, which was unaware of the presence of these proteins before, sees them for the first time and considers them foreign bodies, just as it would deal with viruses or bacteria. It begins to prepare an army of T cells to fight them, but the problem is that these proteins are not only in the injured eye, but also in the healthy eye. The result, the immune system attacks both eyes, thinking it is protecting the body, but in reality, it destroys vision in a condition known as sympathetic ophthalmia. The eye enjoys what is called immune privilege, where the immune system cannot fully respond to threats inside the eye to avoid inflammation that could cause significant damage to the sensitive eye tissues. So, how does the eye defend itself if immune cells cannot enter? The eye uses lysozyme, which is secreted by the tear glands, to protect itself from microbes and maintain an inflammation-free environment. The thymus gland is a small organ located in the chest and plays a crucial role in the immune system. It educates immune cells called T cells, training them to recognize the body's own cells and distinguish them from foreign invaders. This education process ensures that the immune system does not attack the body's own tissues. This mechanism, known as immune tolerance, is vital for preventing autoimmune diseases. When immune tolerance fails, the immune system may mistakenly target the body's own cells, leading to conditions like sympathetic ophthalmia. In the case of sympathetic ophthalmia, the T cells fail to recognize certain parts of the eye, such as the retina or cornea, as they were previously isolated from immune recognition by the blood-retina barrier. This lack of recognition leads the immune system to perceive these eye tissues as foreign, triggering an immune response that causes inflammation in the eyes. Recognizing the symptoms of sympathetic ophthalmia usually appear within a few weeks to a few months after the eye injury. However, they can sometimes take years to develop. Common symptoms include blurred vision in the sympathizing eye pain, sensitivity to light, also known as photophobia, redness in the white part of the eye, and floaters, which are small specks or clouds in your vision. How sympathetic ophthalmia progresses. If left untreated, sympathetic ophthalmia can lead to serious complications, including, in the early stage, inflammation of the uvea or uveitis in both eyes, causing blurred vision, pain, and light sensitivity. This inflammation can be quite severe and may require immediate medical attention to prevent further damage. In the intermediate stage, formation of adhesions or scar tissue between the iris and lens, potentially affecting the eye's ability to focus. These adhesions can make it difficult for the eye to adjust to different lighting conditions. And in the late stage, glaucoma, which is increased pressure within the eye, can develop. This pressure can cause significant pain and further damage to the optic nerve, cataract formation, and retinal damage, which can severely impair vision, all of which can lead to vision loss. Early diagnosis and treatment are crucial to managing this condition and preserving vision. Treatment and the importance of early diagnosis. Early diagnosis and treatment are crucial for preventing vision loss from sympathetic ophthalmia. Detecting the condition early allows for timely intervention, which can significantly improve the prognosis and preserve vision. Treatment usually involves corticosteroids, which are powerful anti-inflammatory drugs that can reduce inflammation in the eyes. These medications help to control the immune response and prevent further damage to the eye tissues. They are often given in high doses initially, then tapered down gradually. This approach helps to manage the inflammation effectively while minimizing potential side effects. Immunosuppressants are also used. These medications suppress the immune system, preventing it from attacking the eyes. They are particularly useful in cases where corticosteroids alone are not sufficient. In some cases, surgery may be necessary to remove damaged tissue or to implant a device to control eye pressure. Surgical intervention is considered when other treatments do not provide adequate control of the condition. Thank you for watching. This video was prepared and edited by Samir Muhammad, a medical student at the Arab American University, under the supervision of Dr. Rasmi Abu Al-Hilo, Immunology Course Professor. And now, let's see our case study.
Hey everyone, welcome back. Okay, so now I want to talk about a case study, but before this I want to make a quick recap of the sympathetic ophthalmia. As we know before, the sympathetic ophthalmia is an autoimmune disease. What does autoimmune disease mean? Autoimmune disease mean that the autoantigen, this is autoantigen, is attacked by the immune cell, and this leads to inflammation. Okay, so this is T cell, right? This is T cell. T cell, listen to me. Attack anything that you want except my own antigen. Don't attack my antigen. This process is known as the thymic education. So what is the thymic education? The thymic education, it is a process that happens or that occurs in the thymus, and by this process we teach T cell to distinguish between my autoantigen and the invader or the foreign substances or a foreign antigen. Okay, so what is the sympathetic ophthalmia? Sympathetic ophthalmia is a rare condition that happens following a penetrating eye injury or a surgery or a trauma that happened to one eye, and that leads to trigger the inflammation to the another eye. The injured eye is known as inciting eye. The other eye is known as what? Is known as the sympathizing eye. Why we call it by this name? Because it like sympathizes with the injured one. Okay, so the inflammation is happen firstly in this eye and then go to this eye because the uveal protein here is same as this. After a penetrating eye injury, for example, the uveal protein will leak it out. But before I continue, what is the uvea? The uvea is the middle layer of the eye. It composed of three content: the iris and the ciliary body and the choroid. The iris is the color part of the eye. The ciliary body is located here, and the choroid is located side by side to the retina. Okay, so after penetrating eye injury, the uveal protein will leak it out, and after this, the immune cell will attack them. But wait, why the immune cell will attack the uvea protein and the uvea is a part of me? Actually, this has happened because the immune cell don't know that they're a uvea. Why this has happened? This is actually happen because something called the retinal blood barrier. So the retinal blood barrier is prevent the immune cell to know that there are uvea because the immune cell don't recognize that there are uvea. Okay, the immune cell is something good. We need it to defend our body. Why we attack? Why we don't need it to enter to the eye? Why? Actually, the eye is a very sensitive organ, so an inflammatory response will happen to it. It will cause a optic nerve damage, and this will lead to vision loss. Okay, as I told you before, there a trigger, and the trigger here is a injury, penetrating eye injury, or a surgery, or a trauma that happened to the eye, and this lead to what? This is lead to uveal protein leakage. This is lead to uveal protein leakage. The immune cell will attack this protein and consider it as an invader or as a foreign substance, and the autoimmune reaction will happen. And now let's talk about our case study. Our case study here is talk about Khaled. Khaled is a 32-year-old man, has been in a good health with no chronic medical condition. Last week, he is suddenly developed with a severe headache that persisted, accompanied with dizziness and increasing sensitivity to light. And as we know from the previous video, sensitivity to light mean as what? Mean as photophobia. So Khaled has a photophobia. After 2 days of the photophobia, he is noticed a redness in both eye simultaneously. What does simultaneously mean? Simultaneously mean in both of the eye at the same time. With a blurry vision, especially when he is exposed to bright light. He also started to experience joint pain, which causes him to feel fatigued. But at the fourth day, after 4 days of the photophobia, he has developed something that called the tinnitus. What does tinnitus mean? Tinnitus mean a ringing in the ear. And his ear is gradually worsened, prompting him to visit a doctor. Okay. During the eye exam, the doctor is observed inflammation in both eye, exactly in the choroid and the retina. As we know before, the choroid is a part of the uvea, and the retina is located side by side to it with something called the exudate. What is the exudate? Okay, so as we know, here is a blood vessels. Here, for example, there are pathogen. Okay, the fluid from the blood vessels will leakage out. This fluid is contain a high amount of the white blood cell, a high amount of salt, high amount of protein plasma. And what is the importance of this? To eliminate the pathogen. This fluid known as exudate. Okay, and this exudate is located beneath the retina in both eye. Khalid confirmed to the doctor that he had no experienced any eye injury or trauma. So Khalid don't have any injury or trauma that happened to the eye and caused this inflammation, but the symptom began simultaneously in both eye. The doctor also noticed the presence of light spot in his skin in various area. The light spot, as you see here, the medical condition, this medical condition is called the vitiligo. And Khaled has a vitiligo, and some area of his hair had turned to white in certain patches. This further test revealed an enlargement of the lymph node in the chest region, along with changes in the cerebral fluid, indicating the mild meningeal inflammation. What do you think that Khalid had? Now you will told me, Samir, you talk about the sympathetic ophthalmia. It will be the right answer. I got you. No, this is not the sympathetic ophthalmia. Why? Okay, so why this is not sympathetic ophthalmia? Khalid don't have sympathetic ophthalmia because, as we know, the sympathetic ophthalmia is an inflammation that happen to one eye, and this inflammation triggered the inflammation to the other eye. Khalid had the inflammation in both eye at the same time. This is the first reason. The second reason is that Khalid don't have any history of eye injury. He don't have any trauma. He don't have any surgery that happened to the eye or a penetrating eye injury. The second and the third reason that why this is not the sympathetic ophthalmia, because this is not a symptom of the sympathetic ophthalmia. So what Khalid here had a autoimmune disease is known as VKH syndrome, or something called the Voget-Koyanagi-Harada syndrome. What is this? I will not explain a detail about this autoimmune disease, but I want you to know that this autoimmune disease is happened due to what? Due to the immune cell become attack the melanin pigment in some tissue that have it, such as the eye, the skin, the hair. Thank you very much for watching, and I hope that you will like my video. Thank you. Goodbye.